So, in Tecfidera is more efficient when patients begin treatment at an early stage of the disease. However, data from your studies reveal that even in those patients that change from placebo to the drug later on in the trial, relapses were significantly reduced. Do you think there is a maximum limit from time of diagnosis for a patient to begin taking this drug?
So honestly, we don't have any data on that. The earlier the better. It's not only true for Tecfidera, it's true for all of the immune medications that we're currently dealing with. However, rather even late, better than never. So that's the simple answer. Theoretically, biologically, there may be some sort of thresholds, but we just don't know.
Okay, so the other question is, what were the outcomes in terms of safety? Because in your press release you mentioned a favorable overall benefit-risk profile with Tecfidera. However, were there any serious side effects when compared to placebo or glatiramer acetate?
So you know that as well in the post-marketing setting as well as in the long-term studies, there were single cases of an opportunistic CNS infection, progressive multifocal encephalopathy. So the one denominator we have right now is a long-standing and severe lymphopenia in these patients. If this is the only risk factor, we just don't know. However, that's the reason why I personally believe it's quite important to have a look at these investigations.
Okay, so for the last question, for the remaining years of the endorsed trial, what outcomes do you expect in the patients and the treatment concerning their relapse rates and quality of life?
If we knew, then we wouldn't have to do the trial. We're talking about the patient population which is switched from placebo now to the active treatment arm. And the question really is whether the effects that we had during the first 2 years or so will be diluted over the subsequent then another 6-8 years or so. We just don't know. I tend to believe, given the experience with other long-term extension trials, that we will see a sustained efficacy.
Okay. Thank you very much, Professor. Thank you.